We're going to keep moving ahead with our last talk for this session. So it's my pleasure to introduce Sohail Daulat. He's going to be presenting multimedia technology and national community collaborations and coalition building to identify and share best practices. Best practices for COVID resiliency in marginalized racial and ethnic communities. Thanks for being with us, Sohail, and we look forward to hearing your talk.
Thank you. Yeah, so my name is Sohail Daulat. I'm an undergraduate student at the University of Arizona, part of the College of Medicine Physiology Department. So I am presenting on behalf of the National Reach Coalition and National COVID Resiliency Network, as well as Martha Moore-Monroy, where we saw throughout the US that people from communities of color between the ages of 18 to 24 were facing increased health inequities, as well as immense decline in youth mental health. As we saw, communities of color were having further limited access to healthcare. There was amplified racism against Asian Americans, increased food insecurities, as well as increased mortality against seniors. There was effect on students because of COVID. It was harder for students to learn because they could not work with other students. Some students prefer in-person learning. There was limited interactions with teachers and limited access to technology. And there was an effect on young adults' mental health as well. The negative effects of isolation caused by schools and activities shutting down and closing led to most young adults staying at home, which caused about 43.3% of youth feeling depressed, according to that study. And so we felt that this was a great community to help. And I, as a person of color between the age of 18 to 24, can really relate with them. And so I started building a model to help build COVID resiliency for this group. And what we saw was there are a lot of benefits of multimedia technology. It is easily disseminated nationally, as you can spread it throughout the US and maybe even internationally and globally as well. It increases community engagement and raises awareness, and it can be used as an effective vehicle to address public health issues. And for this topic, it was more focused on COVID resiliency, but we've seen that it can definitely be used for various topics that address public health concerns. And so what we did accordingly was first identify diverse types of electronic communication to raise awareness of community experiences with health inequities. Then we identified strategies to leverage and strengthen community collaboration, coalition building to share experiences in a trusted environment. And lastly, identified effective, accessible, and multiple methods of disseminating accurate health information to communities. And in the process of all three, we created a model to really help youth build COVID resiliency. And the model kind of revolved around having podcasts and blogs because they were an effective way to raise the voice of young adults. It provided a free space for them to share their experiences. It allowed for discussion. It allowed for people to go on the blog and write whatever they wanted if they didn't feel like they wanted to talk about it, like vocally. Webinars with the help of telemedicine were also very effective at disseminating best practices of community healthcare workers represented from nonprofits and health experts. And lastly, digital stories and social media was also used to highlight community members' personal experiences with COVID. We saw that with digital stories, you're able to show pictures and tell a story. And telling a story with the pictures really had a different impact than just reading or hearing about it. And social media, the visual, same thing, the visual effect really did make a difference. And so what we saw was these were different modes of communication that allowed for you to be able to share their experience and hear other experiences as well. Well, because one, a lot of youth from communities of color were scared to share their experience, whether they felt their experience wasn't bad enough or whether it was some stigma against it, et cetera, et cetera. And so by sharing their experience in a free space, and sometimes they prefer being anonymous, and hearing other people's stories and experiences, it can allow for a community being built, for more people, for more youth to know that there are others going through the same thing and that we're all struggling and we can all work together. But at the same time, we all have our own unique experiences that we need to be resilient against. And so this multiple modes of electronic communication allow for disparate racial and ethnic communities being brought together to share experiences with COVID-19 among youth between ages of 18 to 24. It allowed for success stories and experiences to be shared and disseminated to increase COVID resiliency, as well as it being an effective manner to disseminate information with low cost and low amount of resources, therefore being able to be a lot more accessible. I would like to thank the National Reach Coalition and National COVID Resiliency Network for connecting me to the national community partners and leaders. And then thank you all for listening.
Thank you so much, Sohail. Please add your questions into the chat as you think of them.
So a question was asked.
Oh, sorry, go ahead. Go ahead, sorry.
Question asked, what sparked your interest in researching this topic more deeply? So it was a couple of things. It was one, as a person of color between the age group, I saw a lot of my peers struggling because of COVID-19. A lot of them were telling me their stories of what they're facing, what their families are facing. And it was sad to see that a lot of them are facing issues that they had no control over, whether it's a limited access to healthcare, or maybe it's something that happened to their families in a different country or even different continent, and they couldn't fly out or help, or a lot of them face deaths of family members that they couldn't do anything about, or even meet them in person because of travel restrictions. So just hearing all these stories from my peers, and then meeting with Moore-Monroy, as well as the National Reach Coalition and National COVID Resiliency Network, they started telling me more about what they've seen and how they want to work more with youth between the age group, and how they saw me as a perfect fit. And so we were discussing projects to work on, different things we can do, and we settled on me really focusing on digital stories and podcasts. So I did end up starting the podcast and really enjoyed talking to a lot of youth. And honestly, that's what motivated me to dive deeper and dive further, was talking. And the more I talked, the more motivated I was to continue the podcast and continue collaborating.
Such a really fun way to engage. I think those modes of communication are so popular now. Thank you so much, Sohail, for presenting today and taking time to share your exciting work with us.